Good morning.
Morning, Brian. How are you doing?
Good. How you doing today?
Pretty good.
Pretty good. What's bringing you back in? It's been about 3 weeks or so, which is kind of about standard. We tend to go 3-4 weeks.
Right. My ankle still keeps coming back when I abuse it. A little water skiing, a little mountain biking, and walking around Disneyland. It gets a little stiff.
So it flared up.
Yeah.
And now this is an old
This
injury.
is old. This is 2005.
And that was a fracture, correct?
Yes, fracture from a water ski injury when the back foot came out of the binding and the front foot stayed in, and it overly twisted. It broke one of the bones in there, and then I ended up having surgery in 2 little parts. You've seen the scar tissue.
Yeah, the scar tissue there. Was there any? I can't remember. I could look back in the notes, but was there a plate put in? Or
Never had a plate put in.
No plate.
No plate.
Any fusion or?
No fusion. They reattached something. I honestly don't even know.
Okay. But I know it's still kind of chronically stiff.
Chronically, yes.
And then
stiff.
The scar tissue.
Stiff, and then it affects the plantar fasciitis also. And then just range of motion is nothing like the left foot.
Yeah, exactly. But as far as activity, you're pretty
Still,
active.
Yeah, I'm just not running, but but biking, water skiing, hiking and stuff's fine.
And then what's your kind of your constant low grade pain level? And then when it flares, where do you go up
So
to?
it's between like a 2 and a 4, like just normal day to day, and then after a hard ski run or mountain bike ride, it'll get up to a 7, 8 sometimes.
And then since I've been seeing you now for we're going on about 15 years.
15 years.
On and off during treatment. So thank you for keeping on coming. How much relief do you normally get? Let's say after we do some acupuncture on it.
Absolutely, great relief. It's just like a little reset for my ankle. It's not just the ankle, but just everything. You come out here feeling refreshed. A lot of times I just pass out, fall asleep, and wake up like
the full body balancing,
Yeah.
where your back, your neck, the digestive system, everything just starts to feel better.
The smell, the moxa, the cupping, all the fragrances, everything it helps. It's a good reset.
Yeah, that's fantastic. Okay. And then we have been working on, and it's kind of continual. We just break up some of the adhesions,
The scar tissue.
get the circulation going.
It gets that range of motion better.
Helps your range of motion,
Yeah.
gets you back into that 2 to 4 range.
And I could tackle the day without having to, have that ankle lock up or having to take a little stutter step. Just to kind of realign it. It's set for a few weeks, and then I come back again.
Perfect.
3 to 4 weeks.
Okay, awesome. Well, we'll get you up on the table, and we'll do the normal intake and pulse taking and everything we normally do, and we'll tackle anything else that's going on.
Sounds great. Thank you.
So we're working on this patient's ankle that typically has some restriction due to a fracture from many years ago, and it's a chronic injury, but there are acute flares of the chronic injury. So we take you into plantar flexion. Any pain doing that at all? No? And in the full dorsiflexion, how's that?
Yeah, it's pain on the
On the outside?
on the outside.
Like the back of the outside of the ankle?
No, a little
More up through.
interior.
More up through here?
It's like right in here.
Oh, okay, on the front
and
side.
it comes around to this side too.
Okay.
Yeah, that whole.
Okay. And it's pretty stiff actually trying to invert. Any pain trying to invert like that? Not really?
Nothing too bad. Huh?
And trying to evert, any pain doing that?
Not really, no.
So most of it was on the dorsiflexion.
Dorsiflexion.
And then through
a little plantar.
Oh, and through the plantar fascia.
fasciitis.
Plantar fasciitis. Okay.
And then sometimes the Achilles flares up too.
So the Achilles then we'll get when we turn you over, because that's usually been tight.
Yeah, the calf's always tight as well.
Any discomfort pressing in that one? That one's fine. Any discomfort in there?
No, I mean that's just where the scarring is. So,
Yeah.
like right where your thumb just was, it sends like electrical
Impulse?
pain going towards my toes.
Okay. So commonly then the sites with acupuncture that we're looking for are the sites that are painful, that elicit pain on pressing or even without pressing, pain sites. How's that just underneath?
There's pain there when you press it.
Yeah. As you can see from the Japanese style, these needles are not going in very far at all. They're just barely getting subcutaneously. Also with swelling in bony areas, it's very difficult to get any needle in with any more depth, but we really don't have to. This is already starting to decrease swelling, move the energy. Anything on the front, on the inside there?
No, it hurts when you're pushing.
Pressing it?
Yeah.
Yeah. And then we'll show on video when we turn the patient over, we'll show some of the backside of the ankle treatment, a little bit more of the scar, and some of the Achilles circulation and relaxation from the backside. Thank you for watching. Please like and subscribe.